My name is Starlena Hodges, and my speech is Universal Health Care in America. The old saying is an apple a day keeps the doctor away, but I say so does an empty bank account. And because of this, I believe America needs a universal health care program. I believe that with a universal health care program, we will have a healthier nation, a stronger workforce, and less people on disability. I feel pretty confident that you know someone who has not been to the doctor in a really long time, and more than likely it is because they cannot afford the visit. Or maybe they can afford the initial visit but are afraid of having to go to a specialist and get nauseous at the thought of how much that will cost. I myself feel like I have allowed myself to become morbidly obese because I have not been able to afford health care and have not seen the doctor about ways to prevent this, nor now, as I realize I have a problem, how to correct it. I believe very strongly that a universal health care program will help us become a healthier nation. I do not believe that it takes a doctor to tell me that eating healthy and exercising is how to stay fit, but honestly, most people do not realize they have put on a few extra pounds until someone brings it to their attention. Doctors can offer diet plans and advice about what foods to eat and what to avoid for certain health issues we may not realize we have. And every exercise program recommends that you consult a physician before beginning any new program. How many people do you know that even when they are sick, they carry on with their daily activities because they cannot stop just because they're sick? I believe most of us do it, and the main reason we do not go to the doctor when we are feeling under the weather is because we usually cannot afford to go to the doctor over something we believe to be a mild illness. What we fail to realize is that diagnosis at the beginning of an illness, in most cases, shortens the illness time, minimizing the spread of the illness. And also, when we have no diagnosis, we tend to incorrectly diagnose ourselves, thereby mistreating our illness and sometimes prolonging it by not caring for it properly. In cases of Americans who cannot afford health care, when they sense something is wrong, they tend to ignore it and hope it will go away. It is not always that simple. Proper diagnosis of certain diseases at an early stage could strengthen the possibility of preventing fatality or disability. And in most cases, sexually transmitted diseases are spread by lower class people who cannot afford proper health care. Therefore, they do not get checked, which leads to the spread of STDs that could be prevented if everyone had access to the same type of care. I believe a universal health care program will help us to have a stronger American workforce. When everyone has the same affordable health care options, everyone has access to the same preventative measures. Things such as shots and vaccines, like the flu shots or pneumonia vaccines, help cut back on illnesses. Shortening our length of sick time means fewer sick days. An awareness of avoiding germs, bacteria, and viruses keep us from getting sick. With a universal health care program, these options would be available to everyone and not just people who can afford an insurance company with a $20 copay. With fewer sick days being taken and being able to see the doctor when needed as opposed to when the money is available, getting doctor's notes will help to eliminate job loss due to illness. In some cases, if a person misses too many days without having doctor's notes to prove they were indeed sick, they lose their job. And overall, having illnesses cut short and fewer sick days taken helps the workplace run smoother, especially small businesses. Also, visiting the doctor regularly provides an education to patients about newer illnesses that are going around, and how to prevent or minimize the impacts of them. People tend to take the advice of a doctor pretty well. So when advised by the doctor to stay in bed and drink plenty of fluids, they tend to get better faster. It is hard to follow the advice of a doctor when you cannot afford to see one. Being able to go to the doctor as needed means people do not walk around sick for days waiting for it to go away, causing them to spread the illness to others. Awareness makes a big difference. I feel very strongly that if we have a universal health care program, we could have far less people on disability. Being aware of your family's history and discussing it with your doctor means getting screened for things that could be treated early. Early detection of a disease can open up possibilities of curing or treating it without it becoming a disabling disease. Also, being a part of a universal health care program allows more people to be seen for issues they may otherwise ignore. With this comes the opportunities for participation in trial programs to make new discoveries on curing or preventing illnesses. With a universal health care program, mental health issues can be better understood and less disabling. When everyone has equal access to proper health care, mental issues are identified and studied more closely. We are less likely to have school shootings and mass murders if mental illnesses can be properly identified and treated. When mental health issues are properly identified and better understood, the patients are treated better in general because they are no longer inflicted with something people do not understand. Early detection and preventative measures of illnesses and proper care of injuries can prevent some disabilities. America has too many people on disability. According to the Social Security Administration, about 91% of workers aged 21 to 64 in covered employment in 2011 and their families have protection in the event of a long-term disability. Just over 1 in 4 of today's 20-year-olds will become disabled before reaching age 67. 69% of the private sector workforce has no long-term disability insurance. In my belief, some of the people on disability could, with proper medical care, be taken off of disability and become citizens capable of working. Some mental health issues, with the proper treatment, could be rehabilitated to the point that one could work. There are a lot of people on disability who should not be, who, if given the right medical care to begin with, would never have become disabled. That would leave room for those who have worked all their lives and now have an actual disability to be able to get the help they need. And so, in conclusion, I believe a more universal health care program would increase our well-being, make us stronger, build our ethics. We should come together as a nation and tell our government that we want a healthier nation, a stronger workforce, and fewer able people on disability. We should all strive for a more universal health care program, one that gives us treatment based on our needs, not our bank accounts.
Yay!
Thank you.
You
just have it.
Sorry, Christopher was the one making that noise.
Sure it was. Hey.